Hi, welcome to this brief video on PWM, accessing your admitted patients on a physician status board. If you're not already logged into Meditech, please click on the Meditech Live icon and enter your username and password. Once in, click on the PWM application. When you first enter, it'll default to your desktop. As you can see over here on the right, the desktop is in white. On your desktop, you'll be able to see new results, admissions, discharges, and transfers, consult requests, incomplete records, orders, and any messages. Up here in the results, you'll see this little paper with the yellow asterisk, and this will mean that there is a result that you have not yet viewed. If you double click on this, it'll open up and you'll be able to see the result. You click list and it'll take you back. Admissions, discharges, and transfers. You can expand. And the same thing here, if you click on the little asterisk, and it'll tell you more information. So for this, it's saying that there was an admission notice, the admit date, the admit time, and what room they're in. If this was a real patient, there would be the reason for visit and diagnosis listed. Consults, if you were consulted for anybody, same thing here. If you were to click on this, it'll open up and tell you who was requesting the consult. Incomplete. This is if you have any deficiencies. I'll click on this one just to show you. Medical records will put any deficiencies in here. So on these ones, you can see that there is a signature required on this report. Right from this screen, you can click over here in the bubble, and it'll take a moment, but it'll open up into your sign queue. You can exit, process X, put in your, hit sign, hit your PIN, enter, and then it'll sign it. So cancel and list, and then it'll take you back. Orders, this will list any renewable orders that you need to address. So we can click on this one just to view it. So this is the order for a Foley catheter. They do expire in 3 days. So you either need to renew the order or discontinue it. From here, if you did want to renew it, you'd have to come down here to click the Orders tab, and then you could renew or cancel that Foley order. List will take you back. Messages, this function is not used very often. If you do ever get a message in here, I believe it would be very rare. But same thing here, you could click on it and it would open up. So list will take you back. Now over here on the right, we're going to click on status board. This will open up into all your admitted patients in your status board. As you can see, the information at the top correlates with the patient that you have highlighted in green. So if we were to click down here to test Josh, again, his information will correlate up here at the top. If these were real patients, I'm sure there would probably be some lab work and such. You'd be able to see that information down here at the bottom. Another handy thing here is this reports button. You click on this. I'm just going to click the hospitalist report, but if you were surgical, you could click on the surgical report. This will bring up a nice sheet that you could print out if you wanted to use for your rounding purposes. Again, if these were real patients, the majority of this information would be filled in, so you would have what their diagnosis, their diet is, just a nice little sheet to take around with you. You just click print, and then it'll print. I'm going to cancel. I'm going to bring over another screen here. You can see down here I have Test Benjamin highlighted, so his information is going to show up here at the top. Over here he also has a new result indicator that's in yellow. If we were to click this, it'll open up and it'll show you the lab work. Just going to close out. Now that results indicator has gone away. So again, over here on the right, I'm going to click on emergency. Now when you're in the emergency tracker, the emergency room tracker, this is for viewing purposes only. Do not ever admit or do not ever put orders in or documents on an ER patient. Doing so can cause problems. Ultimately, what could happen is you'll have to re-enter all the orders correctly on the admission. So when you're in the ER tracker, please just view only. So let's just pretend that this patient here was somebody that you wanted to view their information on. It is highlighted. You could come over here to EMR. It's going to ask you to sign up, continue, or cancel. And since there's another physician that's already signed up for this, we're just going to do continue because we just want to view the EMR. And we're going to say yes. So once in here, you'll be able to look at any imaging or lab work or whatever information you'd like to view. If you're finished, you can just do record list. It'll take you back to the tracker. If you are finished with the tracker, you could just close out of it and it'll take you back to your status board. Next, down here, open chart. Again, we're still on Test Benjamin. So we want to open Test Benjamin's chart, which is his EMR. So opening his chart, you can see we have more options over here on the right. Special panels, if you were interested in something specific, you could click on these and it will give you information. 24 hours, this patient has only been here since Tuesday, so we can only see his lab work from then. But if the patient was here for more days, you could click up here and see more information from each day. Order history, this will be all of the orders that were ever ordered on this patient. So you could look through there. Clicking in the headers will sort by category. Labs, it's pretty self-explanatory, but it's all the lab work. Right now this patient only has a CBC done. All of these other buttons are low lit because there's no information there. Up here it also says selected visit because this is for this visit only. If this patient had more lab work that you were curious, wanted to see, you could click lifetime. And this patient does not have any, but it would show you a lifetime record of the lab work that they've had done. These are low lit over here on the right, the microbiology and pathology, again because there's no information there, but had the patient had any micro or pathology sent out, you'd be able to click on these tabs and see the reports or what specimens were sent. Over here on imaging, this is where you'll see the selected visits, imaging. This patient has a chest x-ray. Over here we can see that the report is completed. There's a little bubble. By clicking on the bubble, it'll open up and it'll give you the report. Again, this is a test, so it's not a real report. Also, if this was a real patient, there would be another little column over here that would have a camera in it, and you'd be able to click on that camera and it would open up into our iConnect and you'd be able to see the image. So you'd actually be able to see the image of this chest x-ray if this were a live patient.